Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Dusablon, your host for today's show. Through this monthly program, we bring you information about Franklin County Home Health Agency's programs and services, as well as tips to help you and your loved ones stay safe and healthy at home. On today's program, we'll be hearing an update to the activities in 2013 at Franklin County Home Health and to see what's new. And for that, I have two guests with me today from Franklin County Home Health. Janet McCarthy, our Executive Director. Thank you for coming back.
Thank you,
You've been
Jen.
with us before. And Barbara Murphy, our Chair of our Board of Directors. And thank you for coming on the show for the first time, Barbara.
You're welcome. Thank you for inviting me.
Sure. So, Janet, if you could just begin with giving an overview of what Franklin County Home Health Agency does and give us some history about the agency in Franklin County.
Sure. So Franklin County Home Health Agency has been serving our community since 1969. We provide home health care, hospice care, long-term care services, and a whole variety of other kinds of programs and services that are geared toward prevention and wellness. Mm-hmm. We have two offices, one in St. Albans and also another one up in the Enosburg area to serve those towns that are in that northern part of the county, and we serve all the towns of Franklin County.
Great. So you've told us what kind of programs you have. What are some of the newer programs that either started recently or in this year?
Well, you know, one of our major goals is always to try to meet the community needs, and we're doing that through the implementation of two new programs really geared towards the new mothers in our community and also our pediatric population. So the Nurse Family Partnership Program is an evidence-based program out of Denver, Colorado that serves first-time low-income moms and really helps them to get off to a very healthy pregnancy, and we serve the child all the way up until they're 2 years old. So we're about 18 months into implementing that program, and we've served about 35 women in that. It's been very, very successful. Our second most recent program is a pediatric palliative care program. This serves young people in our community that have life-limiting illnesses, and this is a brand new program that's being introduced through the state of Vermont, and we're currently serving a couple families with this program.
That's wonderful. Thank you for sharing. We have talked a little bit about Nurse Family Partnership on this show, and being 18 months in, we'll probably do an update again on that as well and keep the community in touch with our new programs and our existing programs, so that's good.
So, you know, I think we're still very well known for our home care program and our hospice program. That's where we all started, and that really is the cornerstone for the work that we do in our community.
Mm-hmm. When we started, we had home care and hospice, but we've grown dramatically. So we'll talk a little bit more about the number of people we serve and a typical experience in the day in the life of home health. But before we get too far, I just want to have Barbara tell us a little bit about her history and congratulate you, Barbara, because you were recently reelected as the chair of the board of directors. And so share with us your history at Franklin County Home Health and what made you decide to help out.
Certainly, Jen. I was very honored about 15 years ago when a lovely gentleman named Richard Brown, who I had known in my community, asked if I would be willing to let him nominate me to this board. And as I said, I was honored and accepted the nomination and was voted in that year. So that was 15 years ago. And I served the 2 3-year terms that are what you're invited to do when you're asked to be a member of the board. And in that first 6-year period, I was chair, so thank you for saying yes, I'm back. And just, I loved being on the board. It was a wonderful experience. And as I said, you are invited to do 2 3-year terms, so then that comes done, and you actually have a lovely way to exit and say thank you for the experience. And then 5 years later, I was asked if I would be willing to come back. We do recycle our board members, but would love to bring in new faces, and one of my experiences on the board has pretty consistently been on the nominating committee. And we certainly look to people that have been on our board not only to come back, but to recommend new members of the community. And I do invite people to be in touch and communicate with anyone in their community that they know is representing. We have 15 towns, and we try to cover everybody.
Have someone from each of those areas to get representation.
Exactly.
Can you talk a little bit about the responsibilities of board members at home health?
Certainly. There's the fiduciary, which is most obvious and quite serious, and to really help the agency be stable and strong. But also, as I spoke with the community aspect, I think that is the real key piece as a board member, is to make that bridge from your community to the agency and have it be a two-way bridge, that we bring back information to our community as to the services that are available. I had the opportunity to let someone know that yes, they certainly should give a call, that their parent could be getting some services. They had had a misunderstanding about how they could be eligible, and I quite often don't try to speak as the expert, but just say, contact the agency.
Yeah, we appreciate it. So, in what ways has the agency helped you learn about the services as a board member?
Well, certainly getting beyond the hospice. That is one that we are so well known for. Any visiting nurse agency, I believe now, that is a piece that people connect with our agency, and it is crucial and key, and it's how many families do first make a contact. But we're so much broader now, and there's so many services, from wound care for anyone of any age who might just need a little help when they're straight home with something that needs treatment, to this new child aspect that we're really a part of people's lives. Keeping people in their communities and assisting with the needs in a way that allows people to retain their dignity. It really is a very special service that the agency is absolutely very good at doing.
Yeah, very, very good. Well, we're so glad that you came back when you were invited, and that you're there to help out and help spread the word, and then, like you said, recognize folks who could be a part of this too and do the good work that you're doing on the board. So thank you for being here. You've both mentioned the growth and sort of where we started with services and how we've grown to add new things. So I imagine it takes a lot of people to do that. So talk with us, Janet, about staffing. How many people we employ, and some new faces. Yeah,
we employ just under 200 folks. That's nurses and physical therapists, occupational therapists, speech therapists, social workers, our home health aides, our care attendants, all of our billing staff and office staff, all the folks that really help to support all of our field workers. We've grown quite a lot since we started. I think we only had 6 employees back in 1969. So we've continued to add staff as we've developed and evolved our services.
Good. And we have you mentioned it's like a menu of waitresses who remember all those things. We have so many different types of staff that we employ, but we also have volunteers. Can you talk about?
We do have volunteers.
In addition to board members, but talk about the volunteers.
Yeah, we currently have about 45 volunteers. Last year they provided over 2,000 or 3,000 hours to support primarily our hospice program. The volunteers do a variety of things. They can go out and visit with our hospice patients and our hospice families. They assist us with our events. Our most recent significant fundraising event, the Blue Jean Ball, really benefited from all of the efforts and the hard work and support that we receive from our volunteers. From time to time we have a need for volunteers to be in the office, whether it's stuffing envelopes or assisting us with some kind of internal administrative process. Lots of opportunities.
And so to volunteer, get information, folks would just give us a call.
Just give us a call. Nancy DeLude is our hospice volunteer coordinator, but she coordinates all kinds of other activities. So give us a call. We'd love to hear from folks.
Call and talk to Nancy. Okay. So you talked about the Blue Jean Ball, and I know you were both very busy with the Blue Jean Ball this year. Can you talk about how that went, and then, of course, why we need to raise money that way?
Well, I think it was phenomenal.
Yeah.
It was just, certainly very successful from a fundraising perspective. We had tremendous support from our community businesses, tremendous support, as I mentioned earlier, from our volunteers and the community in general. It was just very, very fun. Dancing and auctions, and again, raised a significant amount of money that helps to support our programs and services. So we're planning already for next year.
Yes.
We hope folks will put it on their calendar.
So this was the 5th year, so we'll keep that going.
That's right.
And it's usually in October, so
Correct.
folks can stay connected and enjoy the ball. Yeah, it was a lot of fun. I enjoyed it too. So why, though, do we need to raise money through things like the fundraising events and the other appeals? What is the need?
Well, you know, unfortunately, there's still a number of members of our community that don't have health insurance, but they still have health needs. And oftentimes home care is the best way for those needs to be met. And so our fundraising, our charitable contributions through memorial donations, honorariums, our support from the United Way and from town allocations really help us to provide care to those people who either don't have insurance or insurance doesn't cover the whole bill. We provide about $450,000 in free care last year, you know, we're not seeing that need change.
Mm-hmm. So regardless of the person's ability to pay and whatever the condition is, if it's medically necessary, we're going to be there, and we need the community support to make that happen. You did just mention quickly some of the other ways. So the fundraising event clearly raised money through the silent auction, through sponsors, and through the people coming there and enjoying a good time. But the other things you mentioned were just making honorary gifts. And can you explain how that's done and what that is?
You know, we frequently receive contributions in honor or in memory of a loved one or someone that's been special. So we are very happy to receive those gifts. They really do make a difference in our community, and we make sure that those donations are put to good use.
And how do people make those gifts?
They can send us a check in the mail. We also have an online ability to make a donation now through our website, which is www.fchha.org. It's a secure and safe way to make a credit card donation online.
Sure, and I imagine you can do a recurring donation or spread your gift out through the year, some options like that when you do it online to make it giving easy. We appreciate those. There's other ways, talk about bequests or other special giving.
Yes, we have been very fortunate to have been the recipient of some bequests this last year. Those folks have thought about us and left us in their will or their estate planning. Those are very, very valuable gifts to the organization, and we truly are very, very appreciative of those.
Very good. And then you also mentioned United Way in towns, so talk about the United Way support and the history there and what they're helping us with now.
As the Franklin Grand Isle United Way has long time supported the efforts of our organization. This year they're supporting our homemaker program, which provides chore services, meal preparation, errands for people in our community who are aging or younger people who have disabilities and can't get out and about to do those kinds of things themselves. The other program that they're also supporting this year is the development of our pediatric palliative care program. So we're very appreciative of their support, and they're right in the middle of wrapping up their campaign, and we're wishing them the very, very best in their campaign efforts.
And you're in the agency are doing your own fundraising?
Yes, we are. Our employees have made contributions. We have a couple special events within our organization, and we have another one coming up next week. Mm-hmm. So we're very happy to support their efforts.
Very good. And so the towns, either one of you can talk about the town funding and town support.
Well, I think that's the piece that I, again, as a board member and representative of the agency, can bring back to my community. And at town meeting, even if you're not a board member, you may be tapped if we don't have someone in your community to speak at town meeting for the agency. We try to be on people's budgets, the town budget, but in some towns we're doing the article on the ballot as opposed to the budget, if that was what seemed to be a way that worked with the community. But it is important to speak at the town meeting in support of this piece that this year we've managed to be about $450,000. Last year I believe it was closer to $600,000. That was aid we gave to communities without any ability to get paid for. And in my first 6 years it was a bit easier. Our financial status was better, as was everybody's. Mm-hmm. That is sort of, for me, one of the bigger differences in the two different time frames I've been on the board is we're not in as a financial secure status as we were. I believe we do very well as an agency. We're very strong, but we, as all people, don't have unlimited amounts. And so being able to really acknowledge that gift, one of the things we've asked the communities when we have now come up with the amount that we're requesting is we've upped it to being based on the 2010 census. Mm-hmm. It had been, I believe, based on 2000 or even earlier. It was on the 2000. So we've based it now on the 2010 census count for the communities, mm-hmm. and are asking people to give $2 a count, asking that of the communities. So that's how we come up with the amount we asked. and being able to explain that at town meeting, and for me, the testimonials that come forward. I've been to every one of my community's town meetings that I was in town for since I moved to Fairfax, and being able to hear people share their stories is such a piece of the agency's support. It's very critical.
Thank you.
Yeah, so we're currently circulating petitions to be on the warnings for the town meetings in March for the city of St. Albans, the town of Fairfax, and the town of Fairfield. And so we appreciate the community supports, ask for folks to sign those petitions when they're brought, or if anybody would like to send around a petition, they can give us a call and we'd be happy to have them help us out. It's a big job. We really want to get the word out, and we really, again, appreciate the community support. Years and years ago, each of the town communities actually employed their own nurse. So this was before the beginnings of Franklin County Home Health, and the town nurse would be the one that would check on its people after they came home from the hospital, or if someone had the flu, the town nurse would go and check on them, perhaps give injections, perhaps help the bath, perhaps adjust and change, or so forth. But those town nurses are a thing of the past, and we're here to support the community.
The whole countywide. Can you talk, since we're talking about that Franklin County Home Health serves 15 cities and towns in Franklin County, talk about the rest of Vermont and how we relate to the other nonprofit home health agencies?
Yes, so there are 11 nonprofit home health agencies in the state of Vermont. We work very closely together as a network of home health agencies. We're all independent, but we really look to each other, strengths and learning, and do a lot of collaborative kinds of activities and education, policy development, really, because it's been very, very important for us in Vermont to be able to provide home health and hospice services to every single community throughout Vermont. So that's been very good. We're also all have recently joined the network of the One Care Vermont, which is the accountable care organization that is part of Vermont's healthcare reform efforts, and we're very happy to be part of those efforts as things get underway in Vermont.
Wonderful. We'll look forward to hearing more about that as that gets underway. You're talking about collaboration. Some other local agencies you collaborate with include?
Yeah, we work very closely with Northwestern Medical Center. We work very closely with Fletcher Allen Healthcare, Northwestern Counseling and Support, Champlain Valley Agency on Aging, the Adult Day Program here, Care Partners. We really can't provide services to our communities without looking to the resources and strengths of our community partners.
So let's go back, bring it back home to a typical day in the life of a home care worker. Pick a discipline and talk about what that looks like.
Well, I'll speak from a nursing perspective because that's where my education and training is, but very often the nurses come in the morning, they get their schedule, make contact phone calls to their patients to confirm the time of their visits, contact physician offices to follow up on any orders that need to be obtained, get their supplies for the day, and then they head out. A nurse typically makes between 5 and 6 visits in a day. We try to be very efficient and economical about where our nurses visit, so most nurses visit in a geographical location. They make those visits. They may be seeing patients who need wound care. They may be seeing patients who are newly diagnosed with diabetes or another chronic health condition. So they're very involved with educating the patients and their families. Our nurses also provide hospice services, so they very well may be providing nursing care to an individual in our community with a terminal illness. They collaborate with their team, physical therapy and occupational therapy, speech therapy, the social workers, and our home health aides to make sure that our care is integrated and coordinated. We're computerized now, so not all of our nurses come back to the office. They're able to make their notes and actually send the notes through the internet to synchronize so that nurses on call have real-time access. The business office has real-time access to the activities of the day. So we're a very different organization than we were back in 1969, using technology and all the new kinds of evidence-based practice and new ways of doing business in healthcare these days.
That's good. Even some of the care has been automated through home telemonitoring. And
absolutely, yes. We were able to monitor patients' vital signs using technology, keeping very close tabs on patients that may run into some problems, and oftentimes we can head those problems off at the pass, avoid an emergency department visit, avoid an unexpected doctor's office visit, or a hospitalization. Really all, helping people stay healthy at home, reducing cost and the cost to the healthcare system.
Meet all of our goals. Sure.
Absolutely.
So you described a typical day. Folks who are interested in working with home health, what should they do?
Yeah,
what should they know?
They can check out our website. We have job postings on our website. Feel free to give us a call, speak with our Human Resources office. I think one of the things that we have really enjoyed, or I enjoy, is a very flexible work schedule. So we are family friendly, and I think really home health is just a very exciting place and a very good place to work.
Mm-hmm. Well, you just celebrated this fall. You had milestones. You always have milestones these days of 25, 30 years, and so there's something good there. People want to stay that long. That's wonderful to celebrate that, and for come back and work on the board and everything. So it really speaks to the good team that you have going at Franklin County Home Health. And you've been many years there yourself, Janet, so thank you for your work. We're getting close to running out of time, so if there's anything else you would like to share while you were here this afternoon?
I would just like to thank our community, thank our employees, thank our volunteers, thank our board members for everything that they do to help our organization be successful and allow us the privilege of caring for our community.
Mm-hmm. Thank you.
Well, I think that tying it back to when towns had their own visiting nurse, their town nurse, some of our employees do work within their community. That is, when Janet was talking about the flexible piece of being a member, it is something that there still is that true passion from our employees, that they love what they do, in that they're able to do it within their community.
Get a direct impact on their own community.
Absolutely,
and make a
absolutely. And for the person that's being served, for our client, it's that connection, that it's a familiar face. It is truly neighbor helping neighbor, and I think that's very critical and part of the fact that Franklin County Home Health it is Franklin County, it is your community.
Very well said. Thank you. Well, thank you both for coming and sharing information about what the agency's been doing this year and what's coming down the road. We continue to update folks here about our programs and services, but if individuals want more information about anything we discussed today, from making a gift to Franklin County Home Health to receiving services, you can call our agency at 802-527-7531, or visit us online at www.fchha.org, and there's online giving opportunities and job opportunities there. And you can also find a link and like us on Facebook, so you can stay up to date on a lot of the fun things we're doing and new programs and activities that are happening in our community. So thank you for watching today, and be well.